So I wanted to bring up a couple points and just discuss what I think is the reason why you're frustrated going to the doctor. This morning I was digging through all my files and I was cleaning out stuff and I'm shooting stuff away. And I stumbled on some things I kept. I went to pre-med, University of Wisconsin Parkside, and then I went to chiropractic college. I'm not a medical doctor, I didn't go to medical school, but we were taught a tremendous amount of anatomy and physiology and biochemistry. So this morning I'm cleaning out my files and I stumbled on some old little folders that I used to keep, and I used to sketch things out in school so I can visualize it, like this right here. I was sketching out all the cranial nerves. Like, that's a work of art, right? I mean, amazing the stuff that you had to learn. Here's the cranial nerve number 7, all the different pathways, all the different structures. Here's cranial nerve number 9, glossopharyngeal, and just the detail that you had to know was just crazy. Here's another one right here, cranial nerve number 5. Actually, I was quite a good artist there. But the depth of anatomy and physiology that we had to learn was quite crazy. I mean, here's the anterior and posterior lobe of the pituitary and all the different hormones, all the different functions, all the different pathways, all the different pathologies, the different types of cancer. And here's a little chart on ClassNet renal physiology, the study of the kidney, and all the different things that you had to know. Quite extensive. But what really hit me this morning when I was talking to my wife about this, everything is like classification. All these diseases are a classification or labeling these conditions and diseases, and of course the anatomy and physiology, but there's very little practical application. And that means, what do you do with all this stuff? So I pulled out a medical pathology book just to kind of show you a couple things. And I pulled out, hyperkalemia. That means hyper is high, kalemia is potassium. So the condition of high potassium. So here's just an example of what I'm talking about. So you look at the basics. So it talks about how common this condition is, the risk factors, genetics, and then we get etiology, which is basically the cause, of high potassium. And it gives you all these potential causes, okay? Then you have the diagnosis, and then you have the treatment, which is medication. Now, here's the big problem that I see. There's probably about, I would say, 40 different causes, but they don't teach you the connection between diet. They don't give you the practical knowledge of what you're going to find when you actually work with a patient. They definitely do not connect the food aspects of what that patient is putting in their mouth that could create this problem. All right, here's another one, hypokalemia. That's low potassium. So they talk about how common it is, the risk factors, the most common causes. It says decreased intake of potassium. Well, that's good. That's good. Deficient diets, being an alcoholic, elderly, anorexia, vomiting, diarrhea. Okay, that's cool. Kidney problems. And then they show you how to diagnose it. Treatment, medication. Interesting. Okay. Let's see what else they have. The prognosis. All right, here we go. The diet. In patients with mild hypokalemia, that's low potassium in the blood, not caused by bleeding or vomiting, dietary supplementation may be sufficient. Okay. Potassium-rich foods includes oranges, bananas, cantaloupes, prunes, raisins, dried beans, dried apricots, and squash. Well, here's the problem. They're recommending the fruits. What about leafy greens? What about avocado? What about beet tops? What about kale? What about pistachios? These are all much higher in potassium, but it doesn't really tell you what kind of supplementation, because the body needs like 4,700 milligrams. So the problem is they're recommending some foods that have some potassium, but not very, very high. In fact, one banana is 300 milligrams. So you need 4,700. You'd have to have like, I don't know, a lot of bananas, right, to actually fulfill your need. So the big disconnect is practical application. How are we going to use the diet to fix this. Okay, that's really what's missing. Here's another one. Cirrhosis of the liver. Okay, so they have a description. It occurs in 40 and 50-year-old people, predominantly in males. 9th leading cause of death. Okay, that's all interesting information. Risk factors, genetics, etiology. Okay, so this is the cause. Chronic hepatitis, alcohol abuse, hepatitis C. Okay, so we have that. So the diagnosis, physical exam. Treatment, first line. Medication. Wow. Okay, so let's keep going here. Surgery. Oh, they do have complementary and alternative medicine. Milk thistle, that's good. Ongoing care, they talk about diet. A high protein diet may cause more problems, but protein restriction is no longer recommended. Coffee consumption has a graded and inverse association with liver cancer. So again, they're not showing you the stuff that's really, really, really important, like the high levels of insulin in the blood from a high carbohydrate, refined carbohydrate diet causing cirrhosis of the liver. So they're omitting this really key piece of the puzzle. And they don't mention anything about high fructose corn syrup. So this is the disconnect. So when someone going through medical school has to learn all this information, okay, tremendous amount of information, there's not a lot of time to really evaluate and figure this stuff out. It's like, let's pass the test, get through it, graduate, then practice and try to figure it out. But you're coming out of school without the knowledge of the basic foods, the basic information on food, the correct information on what to eat. Okay, here's another one. Anxiety. Okay, so they go into the risk factors. It says right here, risk factors, Caucasian race. Wow, if you're Caucasian, you're gonna have more anxiety. Let's see, family history, genetics, all right, etiology, neurotransmitter problems. Okay, they have a lot of associated conditions. Again, this is like, they're not talking about the vital information, they're talking about the trivial information and just like data overload on steroids. Okay, then we get the diagnosis. Okay, so there is no blood test you can do. This is all subjective. They go into that, asking questions, physical exam. You're not going to actually look at anything on some type of diagnostic test. It's all, again, just by asking them questions. All right, treatment. All right, first line is the type of medication, and they give you a list of drugs. Second line is some different medications. Okay. And then let's see here, additional therapies, cognitive therapy. And then they have, at the last thing, they have complementary and alternative health, yoga, meditation, kava, St. John's wort. Okay. Diet, limit caffeine, avoid alcohol. Under differential diagnosis, they do have something pretty cool. It says nutritional, thiamine. Wow, thiamine deficiency. This right here is the most important thing you need to know about anxiety. It's usually a thiamine deficiency from a high carbohydrate diet or a high stress diet. Because as soon as you give the person thiamine and provide that as part of their foods, you actually can greatly reduce anxiety. And I don't see anything about the adrenals as well. So, high cortisol levels, stress, things like that. I don't see anything about sleeping. So you can see that this is the frustration that you have, because basically in medical school, there's a big disconnect between what you put in your mouth and how it affects all these different diseases, whether it's cancer, anemia, or neurological disorders. The most important thing a doctor should learn and emphasize is the basic diet. All right, guys, well, tell me what you think about this in the comment down below, and I'll see you in the next video. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.